Today we're going to talk a little bit about arthritis, more specifically of the hip joint. But first I wanted to review a little bit about what arthritis is and what it means. So osteoarthritis, OA, is a degeneration of the joint. There's about actually 3 million cases per year. The joint itself becomes inflamed. You can have one joint on one side, you can have another joint another. It doesn't have to be equal on both sides. Pain and stiffness is the biggest thing that most people feel initially. It will get worse as you get older. It can also be called degenerative joint disease or just wear and tear of the joint. Pretty much the cartilage that lines that joint is breaking down, and as that breaks down, one part of the joint comes closer to the other part of the joint because there's no protection between the two. And when that occurs, as one bone gets closer to the other, friction occurs, and then there's breakdown more, so not just the cartilage or cushioning, but also the bone itself. Other things can occur, such as some spurring, where you'll see excess bone formation in the joint, and that will also cause pain. Some of the symptoms of a general arthritis are stiffness. Usually that's worse in the morning. People will complain when they first get up that they're pretty stiff. As they move around a little bit more in the morning, it will start to feel a little bit better. Decreased mobility or range of motion of the hip. You won't be able to move the joint quite as well as you used to be able to move it. Clicking, popping, sometimes catching and cracking. People always say it almost sounds like Rice Krispies because of the noises that the joint makes. And also, if you're younger, more pain with increased activity level, as well as more pain at the end of the day. You will notice that as well. So more specifically, I'm going to talk about a little bit about hip arthritis. And hip arthritis occurs between the ball and the socket, because that's what the hip joint is. So pretty much, this is your socket, this is your leg, the ball at the end of the leg, and it goes into the socket like that. There is a nice smooth cartilage that lines that hip socket there. And what happens is when we have normal hip movement, that ball glides really nicely in the socket. When there is breakdown of that cartilage, the movement isn't so smooth anymore, and you get that crunchiness or cracking or popping sensation when there is wear and tear down there. What happens as far as pain and where can you feel pain? The biggest one and most common source of pain is that you will feel it in the groin area. You will also feel it on the outside of the hip. You might actually feel it radiating into the back and sometimes into the front of the thigh area. The biggest thing is you start to lose mobility in what's called internal rotation. So that pretty much means that your leg is here and you have trouble rolling it inwards. Just think of your toes kind of pointing in. That's the kind of motion that's usually restricted the most. You might also have issues bringing your knee in towards your chest and feeling pain in the groin when you try to do that as well. Weakness is the next thing that starts to occur. Weakness meaning all the muscles that form around the joint of the hip here. And then you also, because of that weakness, start to limp when you walk. People will say it's almost like a waddle gait, where your trunk kind of leans towards the side of the pain over here because you don't have the muscles to be able to support the joint. Biggest causes of hip OA. So obviously I discussed earlier that the incidence of arthritis occurs mostly as we get older. The biggest decades would be between the 60s and 70s years of life. The other things that can also predispose someone to hip OA is heredity. So if your family has a big history of arthritis in the family, then you will be more likely to have that, so it's more hereditary. Also, congenital defects. So if you were born with poor alignment, if you were born with a dislocated hip, they also call that hip dysplasia. If you have rheumatoid arthritis, sometimes trauma to the hip, like from a motor vehicle accident or some kind of injury, that can also cause increased hip OA. The biggest thing to know is also weight can affect that. So the heavier you are can affect that hip joint. So every pound that you gain weight-wise will increase the amount that the hip bears into that socket joint and will cause increased risk for arthritis. The studies show that there's not a huge difference with gender, but generally speaking, women have a slight edge as far as increased susceptibility to hip OA, but not by much. So the next thing I wanted to talk a little bit about is how physical therapy can help. So with arthritis, people need to understand that there's no cure for that, and the thing that we need to work on is giving that joint a good support system. So for the joint to get that support system, we need to address any weakness that is around the joint. So strengthening all the muscles around the joint will give that joint the support system it needs, and it will take the brunt of the weight that it bears through the actual joint off, because it now has other things that can help it. So the more we can strengthen those muscles around the joint, the better you will feel in general. The thing also to understand is that there are other issues in your body, musculoskeletal wise, that can cause the same kind of pain. So when you go to see a physical therapist, we can figure out what that pain is coming from, so where that pain is coming from exactly. The back can radiate pain to your groin and thigh. Your sacroiliac joint can also do the same, so we need to figure out the actual source of your pain, and physical therapists will be able to figure that out for you. We can also prescribe specific exercises based on your presentation. So some people are weaker than others, other people have lost more mobility in the joint than others. So seeing a physical therapist will be able to see what exact exercises you need to do in order to improve the mobility and strength in your joint. Also, use of an assistive device. So as that pain progresses, if you're at the point where you might be in increased risk of falling because of the weakness around the joint, we would be able to help determine which assistive device would be beneficial for you. And sometimes that's not permanent by any means. It's a temporary solution to try to de-weight that hip and make it more make you more functional, just so you can get around and do the activities that you need to do throughout the day. And as you do your therapy, we can get you stronger, and there's a possibility for sure that we can get you off that assistive device, but at least that assistive device would help you eliminate some of the issues you might be having with pain. Help with activities of daily living, so such as getting dressed. People tend to have difficulty putting shoes and socks and pants on because of the decreased range of motion. Just getting in and out of a chair, things like that are something that we can work on. If you don't handle something like this and you don't give that joint the good support system that it needs, you will continue to further decline in your mobility because of the pain it will get to be unbearable. And with this increased pain, you won't be able to do the activities that you like to do. Even short walks will become a problem. You might definitely need to rely on an assistive device more long term instead of short term. And then all of this leads to the point where your joint deteriorates so badly that you will need surgery, and by that I mean a hip replacement. So that's when they actually go in and they replace the joint, which is a significant surgery to have, and that would be at that point the only way to actually eliminate the pain. If you think you might have any of these signs or symptoms that I talked about and you want to look into how physical therapy can help benefit you, then please make sure you click on the link below and we will be able to get you in for an evaluation.